Hello and welcome to the genetics Q&A with genetic counselor Melissa and myself, Valeria Buzanova. I'm an intern with the Norton Elaine Sarnoff Center for Jewish Genetics, and Melissa is the genetic counselor with the Sarnoff Center.
Yeah, thank you, Valeria, for having me today. Just a little bit about me before we get started. I'm a licensed and board certified genetic counselor, like Valeria had said. I have been practicing for 6 years now. I currently work at the Sarnoff Center for Jewish Genetics, but also I work with the genetic counseling focused company Insight Medical Genetics here in Chicago. And I see patients in both the prenatal and preconception setting. And prior to the Sarnoff Center team, I was a full-time prenatal genetic counselor in the Division of Maternal Fetal Medicine at Loyola University Medical Center. I'm also an adjunct faculty member of the Graduate Program of Genetic Counseling at Northwestern University's Feinberg School of Medicine. So thanks for having me, and this will be fun.
All right, so a little bit more about the Sarnoff Center. It is located in Chicago, Illinois, specifically 30 South Wells Street, if anyone was curious. And it is a place where educational resource for hereditary cancers and Jewish genetic disorders. They have their own subsidized genetic counseling and screening program, and they work closely with clergy, healthcare professionals, support organizations, and dedicated individuals. And this Q&A was also held with in coordination with the Illini Hillel. And a little bit more about the Illini Hillel. It was first established in 1923 as the first Hillel in the United States. It is a warm and welcoming community where students from all Jewish backgrounds can meet, explore, and celebrate Jewish life in a very pluralistic and holistic environment. And the Cohen Center for Jewish Life also functions with the help and support of the Jewish United Fund. And then a little bit more about myself. I'm a senior in molecular and cellular biology with a minor in business and an MCB certificate in neuroscience. I'm also an undergraduate researcher in the SOCAS lab on campus. I started learning about my own genetics this past summer when my mom did 23andMe. And even though this is not a diagnostic form of determining your own genetics, but it is I think a great place to start to learn more about yourself. And some post-college plans is to be a research assistant, preferably in a neuroscience lab. And my future goal is Southern California and to do grad school for PhD in neuroscience or biomedical sciences. But for now, I actually recently got a job as a research assistant in Middleton, Wisconsin. All right, genetics is the study of heredity and the variation of inherited characteristics. It is passed through parents via germ cells, which are the gametes. And each gamete holds about half the amount of chromosomes that you need. So 2 gametes would produce the full amount of chromosomes a person would need. And a chromosome is a structure that carries genetic information in the form of genes. And so 2 gametes combine to make a zygote, which then develops into an embryo and then a fetus. What are genes? Genes are the fundamental units of heredity. They provide the instruction for a particular trait, such as hair or eye color. Some genes may produce a physical phenotype by themselves, or there may be multiple genes working together. Genes are made up of DNA, and each gene contains the information needed for making a specific protein come to life, and each protein has a particular function in the body. And a genetic disorder is the result of changes, also known as mutations, in an individual's DNA. When a gene is mutated, the protein produced can no longer properly function, and a disorder can result. Some examples include cystic fibrosis, Tay-Sachs, Down syndrome, and many, many more. Genetic screening can confirm a suspected genetic condition and help determine a person's chance of passing on a genetic disorder. Screening is not definitive and not diagnostic. But can carriers still have children? Yes, they can. Based on your carrier status and at what stage of family planning you receive testing, you have plenty of options. And there are genetic counselors like Melissa who will work with you if you have any concerns. If both partners are carriers, your child would have a roughly 25% chance of being affected, 50% chance of being a carrier, and a 25% chance of neither being affected nor a carrier. And what is genetic counseling? Genetic counseling is the process of evaluation to understand an individual's risk of passing on an inherited medical condition to their offspring. A genetic counselor is a healthcare professional with a specialized training in this. And so for the Jewish population, approximately 1 in 4 Jews is a carrier for one of the 50 plus Jewish genetic disorders, which are included in the center's carrier screening panel. More than half of the program participants are carriers of at least one of the 190 genetic conditions on the center's expanded carrier screening panel. The BRCA mutations occur in Ashkenazi Jews at rates more than 10 times higher than in the general population. About 1 in 40 Ashkenazi Jews carry a BRCA mutation. And something different about the BRCA mutation, it is not recessive, it is dominant. So only one parent would need to pass it down to their child instead of both of them. This is different because most Jewish genetic disorders are inherited in an autosomal recessive pattern, meaning both parents would need to pass down an allele in order for the child to be affected. All persons with at least one parent, grandparent, or great-grandparent of Ashkenazi Jewish heritage should get a screening done. None of these disorders are exclusive to the Jewish population, but screening can still provide valuable information for Jewish individuals with a non-Jewish partner. Persons of Sephardic Jewish heritage and their partners may consider expanded carrier screening that includes conditions more common among Sephardic populations with origins in different countries. And a little bit more about what a Jewish genetic disorder means. The term merely describes a group of conditions which are unusually common among Jews of Ashkenazi, Central and Eastern European descent. Although these diseases can affect Sephardi Jews, non-Jews, and those from mixed backgrounds, they appear in those of Ashkenazi Jewish descent more often, as much as 20 to 100 times more frequently. Why are certain disorders more common among the Ashkenazi Jews? Scientists believe that certain disorders became more common among Ashkenazi Jews because of at least 2 processes, the founder effect and genetic drift. Certain disorders tend to be more common among Jews due to the founder effect, and genetic drift refers to the increase in frequency of the genes for these disorders in this group as a result of chance. Are there Sephardi Jewish genetic diseases? As stated earlier, yes, there are, but Sephardi diseases typically differ based on the country of origin. Sephardic Jews are recommended to seek advice from a genetic counselor to determine the most appropriate screening, given what they know of their family history. And so, all this information was brought to you by the Norton Elaine Sarnoff Center for Jewish Genetics and the University of Illinois MCB and IB classes that cover genetics. And now on to the Q&A portion, where I'll be asking plenty of questions to Melissa about genetic counseling, what it entails, and a little bit more about her background as well. So thank you for being here today, Melissa.
Oh, it's my pleasure. And that was a great summary of what we do and what genetics is, a good primer for this conversation.
All right, I'm glad. All right. So I guess first question, what does your daily work schedule look like?
So it really depends on the day because my position's a little more unique where I work with the Sarnoff Center as well as Insight Medical Genetics. My week is split up between a couple of days of traditional clinical counseling, so seeing maybe 3 to 9 patients, either in person or via telehealth or telemedicine, and providing preconception or prenatal genetic counseling, so helping people who are pregnant or planning to have a family and trying to decide what their options are. And then with the Sarnoff Center, it's more about education and community awareness. So going out there and providing presentations, talks similar to, this information session as well. So just trying to help the Jewish community be aware of what these possible risks are and what we can do about them, especially since um, I know the Jewish community, I believe, has been well informed since even in the 70s, and things have really changed. So just making sure that the community stays up to date.
Wow, it sounds like you have very busy weeks.
It can be, even during this time, it can be busy. Um, Even though we're not doing as much in person, we're doing much more virtual, which is exciting and different. And it's definitely a new wave for all of us, not just for genetic counselors.
Oh, yeah, for sure. And you mentioned like the like telehealth. I was wondering if you can tell us more about telehealth. Like, what is it? Role does it play, especially during the COVID-19 pandemic? Like, does it affect the way you perform your job or connect with patients at all? Like, how and like also like how useful is it for you and your patients?
Yeah, so with your first question, what is telehealth? I feel like people are more aware of it now than they have been in the past. Telehealth is either doing phone or video consultations. Thank goodness for technology that we're able to do that.
Hmm.
And it's essentially just instead of being in person in front of each other, it's providing that counseling again over the phone or video. And it wasn't too much of a change for me just because at Insight Medical Genetics, we were already doing some telehealth consultations before the pandemic. So it
Okay.
was a pretty smooth transition going from half in person, half telemed to going all telemed and working from home or remotely. The Some of the differences included instead of telehealth from the patient's home and our home, oftentimes we would be in our office and then reaching out to maybe our partnering clinics, like an OB's office, and so that the patient wouldn't necessarily have to go to different buildings to have their appointments. And so they could go from their ultrasound at their OB's office to talking to us via telehealth and then having a consultation with their physician or their healthcare provider. So it just made a more collaborative, cohesive way of caring for patients. And it's even though it's something we were already used to at Insight, it definitely has changed a little bit just because, emotionally, we're working with a different time. People have other priorities. So it's nice to be able to still connect with people without physically being there. The other good thing about telehealth is the fact that because people can be in the comfort of their own home, we're minimizing that possibility of exposure, minimizing the number of people we're running into, and they don't have to worry about things like transportation or childcare, which can also prevent people from having consults like this. So that's a good benefit. Big limitation, though, is the fact that we're so reliant on technology. So if you don't have a laptop or an iPad or any type of device, it's harder to make those connections. So that's why the phone consult is really helpful too.
Alright, yeah, no, that definitely sounds like the future of medicine, and it definitely, I think, like, definitely provides a way for everyone to still receive the care that they need even during a time like this. So that definitely sounds like amazing what you're doing.
Yeah, I agree. I think it's actually fascinating and so cool that we can, make this connection and things can at least part of what we do for people's health and their care can continue if maybe they're unable to go see their doctors or healthcare providers for other reasons. Like if I know there are a lot of clinics right now that have really cut down the number of patients going through their offices and sticking to more urgent appointments or essential appointments. So being able to still provide this, something that they can, check off their to-do list in terms of their healthcare in the meantime, while we're still getting used to everything.
Hmm.
And I know that I think one of my first questions before I even started telehealth and started at Insight was, you know, does this make a difference for patients? Am I losing some of that connection with patients by doing telehealth? And studies have shown that you don't. There's no real significant difference because, especially during video calls, you still get to have that interaction, even if you're not physically in front of each other. With
Hmm.
phone calls, it's a little harder just because you don't have those nonverbal cues. I can't pick up if a patient's really understanding unless they're telling me they're understanding. So I
Hmm.
often ask a few more questions and check in a little more. So I would say if I had to choose over video versus phone, I would definitely choose video.
Right. Yeah, of course. And then, do you think like there would be more telehealth in the future? Like, like let's say like when this pandemic is finally like over, everything's clear. Do you think that like medical facilities will still continue to like prominently use telehealth, or do you think they'll start pushing for more like in person, I guess like consultations and appointments again?
Mhm. Based on what I've been seeing so far, not just in genetics, but in the healthcare field, I feel like things will change once the pandemic is over or controlled better,
Mhm.
where I think people now can see that we can do things from home. We don't necessarily have to be in person. So that convenience, I think, will start to become more normal and available. I think we'll be doing a lot more telehealth in the future. I know Insights really got this new push for something called virtual insights, where we're really trying to focus on this ability to counsel you from home and still be connected and in the loop with your healthcare provider and your team, your healthcare team. So I really think that's the way it is going. The other thing is too, it's not just us who's doing this telehealth, right? Like there are many genetics companies who can
Mhm.
also provide genetic counseling, right? It doesn't have to be in that traditional clinical sense anymore. And so they are also performing or moving forward with telehealth and phone consults too through those companies or through the industry. It doesn't have to be through your doctor's office anymore. So I'm curious to see how much my life will change to become more telehealth rather than more in person.
Yeah, no, I'm also definitely very curious as to like how things will go forward from here and like how much I guess like things will change.
And I feel like even just seeing your primary care physician, and when you're talking about like less urgent, like a cold or something that hasn't
Mhm.
been gone for a couple of weeks, will start to become more telehealth too. So
Yeah, it's
yeah,
very
we'll really see.
interesting. Um, and then I guess like moving on to the next question, like going back to I guess like what your daily schedule looks like. What are like meetings with your patients like? Like I guess like what is the I get like what entails like a typical meeting, I guess.
So a typical consult with Insight can be anywhere from 30 to 60 minutes long, and it really depends on the indication. So why the patient is coming to see us and having genetic counseling, but also how complex that case may be. So a general session for genetic counseling includes some information gathering, understanding the patient's expectations as well as what we plan to do for that day, having an education portion. So that little starter summary that you had at the beginning of our talk,
Mhm.
going over what genetics is. If you're like me, you talk about genetics every day, but most people aren't like that. So
Mhm.
you want to give them that quick refresher about, going back to biology 101 and talking about what your genetics is. And
Mhm.
then also the bulk of the conversation is about risk assessment. So um, focusing on someone's personal or family histories that may give us an idea if there are any risks for specific genetic conditions or inherited conditions, as well as the decision making involved. So if based on what we tell you about that risk assessment, maybe not just in pregnancy, but in other specialties too, like in pediatrics or cancer, is there genetic testing or what next steps can we do? And really talking that out with the patient so that they can feel supportive and have that information to make the best decision for themselves and their family. And
Okay.
then for more complicated sessions, I would say there's definitely a psychosocial component. So that's where the counseling portion comes in on what I do, and if things like abnormal test results and abnormal ultrasound, or just more serious family history where they've been dealing with it but maybe didn't have all their answers, there could definitely be that emotional part of it. So helping support and really understand those feelings too.
Mhm. Yeah, of course. Um, I guess like what kind of patients do you most commonly see? Like, do you typically see like more married couples? Do single individuals come in who like say like I would like to start a family someday? What are my chances of passing this down? Do you have any like LGBT like Q couples like looking at like IVF um, situations, surrogates at all, interfaith couples, and any all of
Yeah,
the above? I don't like. I guess like yeah.
definitely all of the above. That is a good question, actually. Since I'm in the specialty of prenatal and preconception, we often get patients and their partners come in so that they can both tell us both sides of the family history, and they also both want to be involved in, what planning for a family can entail. And most of the time, we do have male female couples who are married or not married or in relationships, but we definitely have had LGBTQ couples who are part of the IVF process or considering it, and they want to get more information of where to get started, as well as surrogates, definitely. Just having the surrogate mother come in as well as a patient who is also involved in that relationship and that partnership. So that again, everybody's informed and have an idea of what to expect for the pregnancy or family planning.
Hmm.
And then, of course, interfaith couples all around. So not just Jewish and non-Jewish, but the couples who have many different religions, many different backgrounds.
Hmm.
So oftentimes we'll have patients fill out intake forms before they come in to see us, which ask them about their backgrounds and, if there is a particular family history that they're concerned about, so that we can be prepared and be able to tailor our counseling when they come in. So it's definitely more of a personalized experience.
All right, awesome. That sounds like very like amazing, and how you're able to like work with like different like parts of like the population and the community.
It really does. Well, it's great. Yes, I agree. But it really does depend too on the population that
Hmm.
you're working with based on clinic. So, for example, in Loyola, I was working more in a high risk clinic, so maternal fetal medicine. So there was more complex cases, I would say, and the population varied more because we were getting more of the Chicagoland area. So the surrounding suburbs of people having various levels of education and knowledge of science based. And then with Insight Medical Genetics and the Sarnoff Center, because we're within the city, especially Insight is on the Northwestern campus, I
Hmm.
find us having a population or a community who are definitely information gatherers.
Oh,
So people who maybe have a slightly higher, education or knowledge base, and they're the ones who are coming at me with research articles.
oh, okay.
So it really depends on which part of the city or what area your clinic is of the types of populations you work with.
All right, gotcha. So, what was your educational path to becoming a genetic counselor? What did it look like? What kind of school, like what kind of schools did you go to? How many years did it take for you to get to where you are?
So I'm honestly not going to tell you the years because I didn't take a traditional path to get here. Um, I know a lot of my fellow graduate students, they took the more traditional path, I would say. So they went from high school to undergrad to graduate school for genetic counseling. I was one of the older students in my year because I started off doing my undergrad in Canada, where I'm from. I started at the University of Western Ontario, getting a Bachelor in Medical Science. And then after those 4 years, I actually wasn't sure what I wanted to do. So I ended up getting certified in medical technology, and I worked in a hospital lab in Detroit. So I did that for a couple of years and really loved the science. Like I'm a true science nerd when it comes to this stuff. So being able to work at the bench and do these, working at different specialties and just, learning about these technologies was fascinating to me. But over time, I think I had switched gears and I was starting to disconnect from who I was helping. So I
Mhm.
wanted more direct patient care. And at that point, I had no idea what genetic counseling was. I had to I was Googling the best jobs of that year that had patient care, direct care, and genetic counseling was up there as one of the most satisfying jobs. So I was fortunate that in Detroit, there is the program Wayne State University, and I was able to have an informational interview with the director for the genetic counseling program, and they also had an informational workshop. So I was able to, beyond the research that I found online, actually talk to GCs and GC students and fell in love with the idea. So after, gathering the requirements I needed, I was able to get into the Northwestern program here in Chicago. And
Oh,
it was an 18th-month program. Most programs are about 2 years.
okay.
Um, and then, yeah, I haven't really left. I decided I liked Chicago enough that I'm still here.
So you mentioned that the Northwestern's program was 18 months, as like compared to like 2 years for other institutions. Was it like was it the same thing, except more accelerated, or?
Yeah, it has the same requirements. Most programs do have that medical genetics side of things and then a psychosocial component. And
Okay,
it really depends on the program what that balance is like. So there are some
okay.
programs that are more psychosocially forward and the others who have more medical science forward. Northwestern had a good balance, I felt, and it was, you still have a certain number of rotations, and we even started seeing patients very early on with, of course, the supervision of a genetic counselor.
Hmm.
Um, and it definitely just was accelerated. So fitting, you know, rotations, classes, thesis project, all within the 18 months. So it was definitely hard work, but definitely worth it to get through. And then there was that nice advantage of graduating a little earlier compared to other programs. So we had that leg up in terms of finding jobs at the time.
Okay, that's good. Um, did you have any like? Are there like any like internships or like experiences like required to, I guess, like get into a graduate program for genetic counseling or something afterwards?
Um, for getting into a program, it does vary. So some programs require, for example, the GRE, while others do not. There's also a certain number of classes or course prerequisites, like having at least one psychology class, for example. And then I understand too, as things have become more competitive, that there are other programs that may require a certain amount of time or experience, shadowing genetic counselors or maybe volunteering with a genetics group, and just, getting that more well-rounded approach of psychosocial as well as genetic side. So having various experiences that could help benefit, your growth as a genetic counselor. So I think that's become more of part of what you see trying to get into the program. And there are a lot more options, I would say, and opportunities compared to when I was looking into genetic counseling. So,
Okay.
for example, here in Illinois, I know our genetic society, the Illinois Society of Genetic Professionals, ISGP, they host an annual genetic counseling informational workshop, which this year they're also still doing it. It will just more likely be virtual rather than in person, but that's in August.
Hmm.
That's a great way to talk to different genetic counselors of different backgrounds, different educational experiences from around the city and around the area. So you can learn more about um, the profession, but also I think Northwestern has a big part in it too. So talking about their program. And then I know that there's like Northwestern has a summer internship, and just in general, there are a number of genetic counselors in North America that are willing to have an informational interview with students who are interested in the field or would like to spend the day or spend multiple times shadowing and just learning what a clinic can look like. One thing I'm going to make a plug here, the National Society of Genetic Counselors, or NSGC, they have a great link called Find a Genetic Counselor on their website. So you can look up certain genetic counselors of different specialties who are willing to take students or talk to students. So it's a great way if you don't have many opportunities in your area to reach out and kind of learn more.
All right. That all sounds very cool.
I feel like
Uh,
I'm talking too much, so let me know if I'm babbling.
oh no, all this information is very interesting, and I think it all ties together with what you like, what a genetic counselor is, and yeah, it's all very cool to learn. So like you also mentioned like how like it's more competitive to like go into graduate school for genetic counseling and to be a genetic counselor. Like how competitive would you say it is?
I think it was also competitive. Of course, I think it was a competitive when I applied, but it just changed the
Okay.
way. For example, when I applied, I think there were less than 30 programs in all of North America,
Mm,
and I think now we're up to around 40 or so, and
okay.
they're continuing to know more programs to open up at different schools, which is very helpful because there is a demand right now for genetic counselors.
Hmm.
Um, I would say it's more competitive just because of the unique experiences and opportunities that students can have that can give them a leg up. And with the advent of genetic testing and direct to consumer testing, I feel like it's more on the forefront or more mainstream than
Hmm.
it was before. So people actually know about genetic counseling. They're not like me that I learned because I Googled it one year. Like people are learning about it in school and high school. So they're actually on track from a very early moment in their educational career that they know that's what they want to do. So I think it can be more competitive in that way, that there are many students who are looking at these opportunities and making sure that from a very early on um, period that they are already gathering these experiences to get their CV or applications really beefed up. So
Hmm.
I think that's part of what the competition can be like. And I also think it's because of the programs, right? Because of um, the need for rotations and clinical experience that can really limit how many students can be taken on because there's only so many rotations in that area that they can let them experience and go through, right? So I think the programs can range from having only 4 students per year all the way up to 20 or I think 30. So it really varies. And then I think lastly, the genetic counseling programs have moved to a match day. So
Okay.
similar to medical school, they also have taken on that approach, which I didn't have to go through. So I can't speak to what match day can feel like, but I understand it can be stressful and exciting. So, yeah, a lot has changed.
So it definitely sounds like it, but it all yeah. I keep saying this, but it all sounds very cool because like it is very cool. It's
Mm-hmm.
very interesting.
Yeah, I love it too, just because I think genetic counseling as a career has a lot of flexibility or fluidity. You it used to be that every genetic counselor you meet just does that traditional clinical counseling approach. So working in a clinic, working in a hospital, and that's just not how it is anymore. Like we can work in labs and do variant interpretation or work writing up reports. We can work in industry, and instead of counseling patients, you're counseling providers and
Mhm.
being that genetics resource for them. Or you can be on the marketing side and help with educational materials. Or also, I think there's, again, I had brought up before, but in those companies, you can provide telegenetic counseling, but through a company instead of a clinic.
Okay.
So there are so many outlets for what a genetic counselor can do. And if you even want to go beyond that and work on public health and policy, we have genetic counselors doing that as well. So it's nice that with that 2-year foundation of a degree, it can really open up the doors to various specialties and fields that maybe not all careers can provide that
Mhm.
easily.
Okay. So I guess that's the end of my questions. Thank you so much for being here and talking with me and answering all these questions.
Oh, it was my pleasure. I always want to talk about genetic counseling and get more people interested. So if anyone is interested in learning more or have specific questions, they can always reach out to me at the Sarnoff Center.
Right. Uh, Thank you once again, and stay healthy, stay safe.
You too. Take care, Valeria.